peritoneal organ. It is usually located at the 12 rib and at the psoas major muscle. So ito yung kidney. We have two kidneys, the right and the left. On top of your kidneys, you have your adrenal glands. Okay? Ano yung nagko-connect sa kidney, sa bladder? A tube which connects kidney to the bladder. Yes, Rodrigo.
Ureter po.
Ureter. You have your right and left ureter, and then bladder papunta sa environment, in connection, that's your urethra. So again, illustration anatomically, we have here the kidneys, the right and the left kidney. You have your two suprarenal glands or the adrenal gland. You have the connection, a tube, connecting your kidney to the bladder. Okay. Okay, you have your ureters, So, function of the kidney. Can you give me one function ng kidney? Para saan ba yung kidney na yan? Siya lang gumagawa nito, wala sa other organ. One is for filtration, So, filtration of cellular waste, from blood. So, pinifilter niya yan. Kaya sa ihi natin, ideally, dapat walang lalabas na RBCs sa urinalysis. Walang protein, walang sugar na lumalabas. So, pinifilter lahat yan ng kidneys natin. So, regulation of salt and water balance. So, that is the function of kidneys or of the excretory system. So there is a selective reabsorption of water and solute, excretion of waste and excess water in the form of urine. And then endocrine function. Remember, your kidney is responsible for producing this enzyme, this hormone, erythropoietin. Erythropoietin is a agent responsible, diba? It will stimulate the bone marrow to produce more red blood cells. That's why yung mga patient with chronic kidney disease, they are prone to have anemia because they have a problem in secretion of this enzyme, the erythropoietin. So your kidney or the excretory system also have endocrine function by producing erythropoietin and renin. Renin is the one responsible or influences blood pressure. So in male, the urethra also serves as the reproductive system. So kidneys are paired organs, so dalawa, left and right, located retroperitoneally, yung pole, yung anterior pole niya, superior margin, nasa P12, And then the posterior wall of on the posterior wall of abdominal cavity on either side of the vertebral column is the location of your kidneys. They are concave. So look at the structure anatomically of the kidney. They have concave medial border known as the hilum, where the nerves, blood supplies, and lymph enter. Okay, so we have here the hilum where the nerve, artery, and veins, remember in anatomy, exit. So we have ureter, the ureter, a tube connecting the kidney to the urinary bladder. So We have here a funnel-shaped expansion of the upper end of the ureter known as the renal pelvis, which divides into 2 to 3 major outpocketing known as the major calyces, which in turn form smaller branches known as the minor calyces. So from renal pelvis, magiging major calyx siya, magiging minor calyx, no? Then the area surrounding the calyxes are known as the renal sinus, which contains considerable amount of adipose tissue. So ito siya, no? Your major calyx, no? The minor calyx, no? And the renal pelvis. Okay. So in cut section, no, we can see no, yung renal cortex, no, as compared to renal medulla, no, mas darker, mas reddish yung cortex as compared to medulla. So renal cortex and renal medulla. Subdivided into two parts, the pars convolata and pars recta. No? Convolata, nandito yung mga, makikita nyo ba? Eh. Nakikita yung cursor ko?
Yes po.
Okay po, thank you po. So ito yung pars, no? O dito yung cortex, renal cortex, we have here the medulla. Look at the cortex na nasa kanya kasi yung mga convoluted tubules as compared, no? Dun sa straight na tubes, no? Located in the medulla. Okay? So yung cortical nephron includes the proximal convoluted tubule, the glomerulus, no? And distal convoluted tubules. You have your juxtamedullary nephrons, no, made up of distal convoluted tubules, nephron loop, and proximal convoluted tubule, and the renal corpuscles. Renal cortex or the pars convolata. So you can see here the renal corpuscles or Malpighian corpuscles. So dito rin nakikita yung mga glomerulus or tuft of capillaries, no? In the renal cortex, sabi nga natin, nandyan yung proximal convoluted tubule, distal convoluted tubule, and the arc collecting tubules. Pars recta naman, so lahat dito, no, straight tubes, no? The descending, ascending loop of Henle, and the straight collecting tubules. Difference between cortex and medulla of your kidney, no? Sino ba ang merong renal corpuscle? Nasa cortex yan, wala yan sa medulla. Prominent alteration of pars radiata as represented by longitudinal section of the straight tubules and pars convolata for the cortex, no alteration sa medulla, composed only of straight pars, di ba? Lahat ng convoluted nasa cortex, lahat ng straight tubes nasa medulla. Cortex and the histologically or under the microscope, they are acidophilic. They are brighter. It contains more of the secretory portion, where in medulla, sabi rin natin, kahit anatomically, they are lightened. And it contains excretory tubules. Nephrons. What are nephrons? Anong function ng nephron? Ano ba ang nephron? Yeah, Castillo.
Functional unit of kidney.
Very good, no? Galing ni Madam President, no? So nephrons are the functional unit of kidneys, no? There is approximately 1 to 1.4 million of nephrons, no? And meron siya mga parts. Si renal corpuscles or the Malpighian corpuscle, Bowman's capsule, glomerulus, proximal convoluted tubules, and descending and ascending loop of Henle. Again, 1 to 1.4 million of nephrons, no, per kidney. Yan, ha? So nephrons are the functional unit of kidneys. Also, DCT, no, is seen in nephrons. Ito yung ate, pag nakita nyo sa microscope, no? So this is the top of capillaries known as the Bowman's capsule, no? And close, no? In Bowman's capsules. So lahat ng capillaries, may mga red blood cells inside, no? So we have your afferent arterioles, no? The macula densa over here, the distal convoluted tubule, no? The proximal convoluted tubule. Later on, magkikita natin kung ano bang difference nila under the microscope. Bowman's capsule, may dalawang layer siya. So, outer parietal, which is lined by single layer squamous cells, and inner visceral, no? Meron tong mga podocytes, no? Unmodified epithelial cells. Tandaan niyo po ha, Bowman's capsule, ang outer parietal layer niya is lined by single squamous cells. So, outer layer, it is lined by squamous, no? Simple squamous epithelium. Filtration barrier, natatandaan niyo pa yung mga slits, no? Preventing, no? Yung paglabas ng mga macromolecules, no? Like the albumins, the RBCs, no? And the glucose, no? So, basal lamina, fusion of capillaries with podocyte-producing basal lamina. Endothelium of glomerular capillaries is made up of filtration barriers. Remember the mesangial cells, no? They are stellate-shaped, phagocytic. Ito yung taga-phagocyte, ito yung defense mechanism, your mesangial cells, no? So aside from capillary cells and podocytes, the renal corpuscle also contains mesangial cells, no? And they are embedded in mesangial matrix. So ito yung pang-defense, no? Responsible for phagocytosis. Look at the podocytes, no? And the basal laminae. You can see the capillaries and the mesangial cells. Okay. Function provides support and contraction for phagocytosis and secretion. So, defense mechanism natin yan na your mesangial cells. Ito yung nagpa-phagocytes. No? Urinary or capsular space, this is just a space between two capsule layers. Receive the fluid filtered through capillary wall and the visceral layer. So, ito na sila, your capsule. No? The capsular space, your top of capillaries, the glomerulus, which is lined by simple squamous epithelium. No? So, yeah. So, flow, na-discuss nyo na to sa anatomy. Review na lang. Each renal corpuscle has vascular pole and a tubular pole. Ito yung tubular pole niya and the vascular pole, no? So, vascular, so mga blood vessels, no? So, we have the vascular pole, this area, and we have your tubular pole, okay? So, look at your glomerulus, no? With your capsular space, okay? Here, you can see the juxtaglomerular apparatus, tong area na to, no? So, you have your juxtaglomerular cells, the macula densa, no? The afferent and efferent artery. So, itong area na to, this is the vascular pole. Itong area nito papunta sa tube, your tubular pole. So, let's discuss the one of the tubes, your proximal convoluted tubules or the PCT. Longest and most convoluted part. Lined by simple cuboidal epithelium with brush border. Brush border is the one responsible for reabsorption, no? Kaya nare-reabsorb yung mga dumadaan dyan. Cells have granular cytoplasm and reabsorb usually 60 to 65% of water. So yung ating lahat ng tubig na iniinom, nare-reabsorb doon yung 60 to 65% bago siya maging urine. So all glucose, 85% of sodium and chloride. So dapat wala talagang asukal or glucose, walang glycosuria o glucosuria. Wala dapat glucosuria sa urine because it is well reabsorbed in the proximal convoluted tubule. So with your sodium and your chloride. Okay, so this is the cortex of the kidney with juxtamedullary nephron and the cortical nephron. Okay, the corpuscles, no? This is the micrograph showing the renal corpuscles, no? So ito yung mga tubular pole na sinasabi natin kanina. And you have here the urinary space. Look at the glomerulus, no? Top of capillaries, no? Ito yan. Tingnan ninyo yung itsura, no, ng proximal convoluted tubule and the distal convoluted tubule, no? Yung distal convoluted tubules, no, mukha siyang empty, walang laman sa loob as compared to the proximal convoluted tubule. Because the proximal convoluted tubules, no, marami siyang long microvilli or brush border. Kaya mas mukha siyang puno as compared to the distal convoluted tubule, no. Wala kasi itong brush border. Kaya it looks or it appears empty, no, because of lacking of the brush border. So, ano bang function nitong letter U na to? The urinary space. Yan. So, ito lang yung nagdi-drain, no? The urinary space, which is located between the parietal layer of the glomerulus. So, nakikita siya sa parietal layer of the glomerulus, tong area nito, no? Drains in the lumen of the proximal tubules. Papunta siya dito sa proximal tubules, no? Kaya ito tubular pole natin. So lahat dito ng substances, no, will be drained to the proximal convoluted tubule sa area na yun. Bago siya makarating sa proximal tubule, syempre dadaan mo siya sa tubular pole. Next is the loop of Henle, no? So we have the descending limb with brush border, no? U-shaped structure. We have the descending limb, thick, lined by simple cuboidal epithelium and descending limb. Yung thin naman na loop of Henle is lined by simple squamous epithelium. Yung thick loop of Henle, descending loop of Henle, is lined by simple cuboidal. The thin one is lined by simple squamous. Magkaiba sila ng lining epithelium, no? Then we have here the ascending limb, which is lined also by simple cuboidal epithelium but without brush border. Okay? So yung descending limb na thick na line ng simple cuboidal epithelium with brush border, yung ascending limb naman is lined by simple cuboidal epithelium but without brush border. The thin, no, descending limb is lined by simple squamous epithelium. Tandaan niyo po yan, ha? So, ito na ulit natin yung ating mga tubes, no? Next is the juxtaglomerular nephron. So, 1/7 of the nephrons are located near the corticomedullary junction and they are known as the juxtamedullary nephrons. It also allows the kidney to produce concentrated hypertonic urine with short thick descending limb, long thin descending limb, and ascending limbs, and long thick ascending limbs. So ito yung ating juxtamedullary nephron. Distal convoluted tubules lined by simple cuboidal cells without brush border. Wider lumen as compared to your proximal. Pale staining cytoplasm. Sodium reabsorption and potassium secretion by sodium pump regulated by aldosterone. Secretes hydrogen and NH4 which maintain the acid base, your bicarbonates. So your juxtaglomerular nephron and cortical nephron. So again, no, we have abundant peritubular capillaries, draining venues, no? So ito yung mga capillaries natin, ito yung mga ating red blood cells, no? So we have the ducts, no? Over here, the proximal, the distal and the proximal, no? The proximal convoluted tubules and the distal convoluted tubules. No? Para natin ma-differentiate, yung distal convoluted tubules looks pale, no? Wala siyang microvilli and brush border, while ito, meron tayo, kaya mukha siyang punong-puno. So, look at the capillaries draining, no? With the surrounding proximal and distal tubules. respectively. So this is stained with H&E. Okay, one side of the wall of the afferent arteriole at the vascular pole. So this is the vascular pole. You can see the afferent arteriole. No? And this will be modified as the juxtaglomerular apparatus or the JG cells. No? The DCT or the distal convoluted tubules, no? Diba ito yung ating proximal convoluted tubules, no? On the other hand, no, the distal tubules over here, no, you can see, no, the macula densa. So macula densa is lined by columnar cells. So ayan, mga columnar cells lining the macula densa. Macula densa, nakikita siya sa distal tube, no? JG cells, round nuclei, basophilic cytoplasm, responsible for secretion of renin, your angiotensin 1, 2, and your aldosterone, sodium, and what. Ano bang, natatandaan niyo pa ba? Para saan nga ba yung angiotensin? Lalo na yung angiotensin 2. Bakit nga ba bakit nare-release yung renin? Anyone? Yes, Isaiah.
Sa angiotensin 2 po ba?
Yes?
Nakakatulong po ata siya sa blood pressure po.
Okay, so nakakatulong siya sa blood pressure, no? Kung mababa yung blood pressure, no? So yung ating renin will be secreted, no? Pag mababa yung blood pressure, okay? So your renin will stimulate your kidney, no? Para mag-produce na angiotensinogen. Your angiotensinogen will be converted to angiotensin 1, no? And then your angiotensin 1 will be converted to angiotensin 2 with your angiotensin converting enzyme, no? Angiotensin 2 is a potent, no, vasoconstrictor. Kaya tataas yung blood pressure. So, ma-maintain natin yung homeostasis. Okay? So, yung mga patient na matataas ang blood pressure, we give them medication na prevent yung conversion ng angiotensin 1 to angiotensin 2, no? Ito yung mga ACE inhibitor or the angiotensin converting enzyme inhibitor na anti-hypertensive drug para may mababa naman yung blood pressure ng pasyente natin. So may mga gamot na piniprevent yung pag-convert ng angiotensin 1 to angiotensin 2 para maging normal ang BP. So itong angiotensin 2 na to is a potent vasoconstrictor causing increases, no, in blood pressure. So tama si Sunga, no? So responsible si angiotensin 2 for BP elevation. Okay, very good. So it will increase the blood pressure, no? So sa aldosterone naman, yung responsible for the reabsorption of water and sodium. So sodium, yung asin, no? I-attract niya yung water, so there will be more reabsorption of water. Ang problema natin dito, pag meron tayong pasyente na may congestive heart failure or yung pumapalya na yung puso, dapat hindi lesser ang water nila sa katawan, lesser ang absorption, kasi magiging mahihirapan lalo yung heart nila na mag-contract, mag-pump ng blood kung puro natulunod na sila sa water sa katawan. So we give medication for naman diuretics, no, para iihi ng iihi yung pasyente. Mababa na yung sodium and water reabsorption ng kidneys. Okay, so the DCT, no, contains, remember, ang DCT, the distal convoluted tubules contains afferent arteriole, no, and this becomes more columnar and compact, forming the macula densa. So your macula densa is responsible for regulation of glomerular blood flow. Lacy cells, also known as the extraglomerular mesangial cells, no? They are responsible for producing erythropoietin. Para saan ang erythropoietin? Yes, Kimpo?
It stimulates production of red blood cells in the bone marrow.
Very good. So this is the one responsible for the stimulation, no, of the bone marrow to produce more red blood cells. Collecting tubules, last part of each nephron, join each other to form straight collecting ducts, runs to the tips of the medullary pyramids, no, empty into the minor calyces. Tubes are made up or lined by simple cuboidal epithelium. Sa histology, no, kailangan nyo ma-master, no, kung ano yung mga lining epithelium ng bawat organ or bawat structure kasi lagi lumalabas po yan sa examination. Okay? So ducts, now remember, are lined by simple columnar epithelium. Your antidiuretic hormones or the ADH, no, their arginine vasopressin makes the collecting duct more permeable to water. So antidiuretic hormone. So mag-reabsorb ka dyan, hindi ka magde-diurese, hindi maiihi, ma-reabsorb mo yung water. So this is the coronal view of the kidney showing the major blood vessels. No, hindi natin i-discuss to because we already discussed this in anatomy. No? Pero take note of that sa book. No? Nandyan din naman yan. No? Excretory passages, structure that convey urine from the kidney parenchyma to the outside. So we have the renal pelvis, the main excretory duct, ureter, sabi nga kanina, no, right and left. And then your lining epithelium or your urothelium. No? Yan yung mga paano lalabas yung urine natin. No? From renal pelvis, going to the ureter, to the bladder, no? To the environment. So, 3 walls din siya, inner, middle, and outer. Inner mucosal layer, middle muscular layer. Under ng middle muscular layer, we have your outer circular layer, inner longitudinal layer, and then yung pinaka-outermost natin, laging-lagi naman, si adventitia. Inner mucous, middle muscular, and outer adventitia. So adventitia is made up of loose collagenous connective tissue wherein the blood and lymph vessels and nerves are located. 3 layers of urothelium, so single layer small basal cells. Superficial layer are made up of these. Tandaan nyo to ha, sa urothelium you have the umbrella cells. No? Umbrella cells are multinucleated, protect the underlying cells from cytotoxic effect of hypertonic urine. So ang nagpo-protection no, doon sa ating bladder is the umbrella cells. Next is the renal pelvis, flattened funnel shape, end of the ureter in the hilum of the kidney that branches into major and minor calyces. It is lined by transitional epithelium or your urothelium. No? Lamina propria is made up of scanty alveolar connective tissue. It doesn't have glands. No? Marami siyang blood vessels, no? Small lang, and lymphocytes. Next is the ureter. These are muscular tube that connects the kidney with the bladder. Walls are much thicker than renal pelvis. Lined by transitional epithelium, no, forms longitudinal mucosa folds when empty, giving the lumen stellate shape appearance. So, collapsed state, pag walang laman, walang dumadaan, so columnar, distended, cuboidal. So, hollow organ yan, tube-like structure, kaya ganito ang itsura niya under the microscope. No? You have the walls, the layer, the mucosa, the muscularis, the inner and outer longitudinal, and we have the inner outermost layer, which is the adventitia, where we can see the small blood vessels. Okay, so lamina propria, dense superficial part, made up of loose superficial part, no glands with diffuse lymphatic tissue. Muscular area, upper 2/3, thinner. You have your inner longitudinal and outer circular layer. Lower 1/3 ng ating ureters, no? We have your inner longitudinal, middle circular, and outer longitudinal. Terminal portion, non-circular muscle, only the inner longitudinal and outer longitudinal. Tunica adventitia made up of loose connective tissue. Urinary bladder, yan na, yung pantog, no? Hollow organ for the storage of urine, lined by transitional epithelium, highly vascularized yan. Submucosa, we have the muscularis with detrusor muscles, no? Inner longitudinal and middle circular and outer longitudinal. Ito na tayo, no? Your urothelium, no? Transitional epithelium, yan, di ba? Pag ito ay with water or with urine, ano yung, ay, sama ko na ako. Wait. Pag with urine to, ano yung itsura niya histologically? Kaya nga tinawag na transitional, di ba? Kung filled with urine, may stretch siya, anong itsura niya? More on anyone? Kaya nagta-transition di ba? Nagpapalit, kaya transitional epithelium. Pag empty yung bladder, ano itsura nung histologically? Yes, iso nga.
Columnar po ba pagka distended po?
Pag distended, marami. Pwede. May urine sa loob, distended, di ba? So, mai-stretch siya. Tatanda yun sa anatomy. Yes, Castillo.
Pag filled with urine po, simple squamous po yung epithelium.
Very good. So, na-stretch kasi siya, no? So, it looks like a simple squamous epithelium pagka filled with urine. Pag empty naman, ano na itsura niya? Ano na itsura niya? Pag hindi siya stretch, ano na itsura niya? Kaya transition. So, pag filled siya with urine, no? It looks like a simple squamous epithelium. Pag hindi, anyone, may plus 10. Andrew.
Ma'am, for me po, parang simple cuboidal po.
Simple
Parang-
cuboidal epithelium. Tingnan nito, Andi pa na siya, More on cuboidal ba siya? Angela. Kim,
Ma'am, kapag ano po ba siya? Kapag unstretched po, stratified squamous epithelium po ba siya?
pag stretch, simple, squamous epithelium. Pag nakarelax siya, ano yung itsura niya? Kim po.
Simple columnar epithelium po.
Simple columnar epithelium. Okay? So, take note to. Pag, depende yung itsura kung na-stretch at saka kung relax yung ating urothelium or transitional epithelium. Pero pag tinanong kayo, what is the lining epithelium of bladder, the answer is transitional epithelium or urothelium. Unless itanong kung ito ba ay nakarelax or filled with urine, doon lang tayo mag-iiba. Pero pag walang ganang question, wala sa question yung status ng inyong bladder, lagi ang sagot natin is transitional epithelium or urothelium. Clear tayo doon? Para hindi kayo mamali. Tandaan nyo yan pag wala siyang, hindi siya specific, so ang sagot pa rin is transitional epithelium. So look at your detrusors muscle, So, marami siyang muscle yung bladder natin. So this is the mucosa where your epithelium line, followed by submucosa behind the mucosa, and then we have napakadaming muscles, So ito tinan mo, superior wall of distended bladder. So pag punong-puno, acidic environment yung bladder natin, becomes simple squamous as compared doon sa walang laman or empty bladder. Tunica adventitia made up of fibroelastic connective tissue. Peritoneum covers the upper part of the urinary bladder. The ureter passes through the wall of the bladder, obliquely forming a sphincter of the bladder. So may sphincter din dito, So hindi na dapat bumabalik yung ihi natin pag nasa urethra. So this is the bladder wall or the urothelium. So ito yung wall, bladder wall. So we have here you can see here the mucosa, your urothelium, followed by lamina propria. We can see after that is the submucosa with inner longitudinal, diba? Middle longitudinal and outer longitudinal muscle, And then the adventitia. So tingnan mo yung layer ng muscular niya, tatlong layer. The inner, middle, and outer layer, muscular layer. That is located after the submucosa. So this is your mucosa, may lamina propria, and then submucosa yung nasunod na layer, and then the muscular layer. And here, you can see the adventitia, the outermost layer. Male urethra, made up of long, consists of 3 portions. Prostatic urethra, 3 to 4 cm long, extend through the glands, prostate gland, lined by urothelium. In the middle line is the opening of the prostate vertical. On the right and left are the slit-like opening for the ejaculatory ducts. Ito na yun. So this is the bladder. Kita niyo yung cursor, So we have here, the tube, the ductus deferens, You can see here the prostate, and then ito yung rectum, anus, the penis, the glans penis, diba? So talagang hindi common sa lalaki na sila ay mag-urinary tract infection or UTI kasi napakalayo naman ng opening ng kanilang urethra sa anal area. Okay? So hindi naman abot yan. Okay? Kaya mas common yung sa babae na mag-urinary tract infection. Okay? So you can see here the seminal vesicles, and the area of your prostate. Itong prostate na to. So you have your constriction. And then the testis. Okay? The epididymis, At yung outpouching, that's the scrotum. Okay? Discuss na lang natin yan sa male reproductive system. So, membranous urethra, short as compared to yung kanina, So, lined by stratified columnar or pseudo-stratified epithelium, extending from the lower pole of the prostate to the bulb of the corpus spongiosum. Spongy urethra, longest part, 15 cm, gano'n siya kahaba, transversing the whole length of the corpus spongiosum, lined by pseudo-stratified or stratified columnar epithelium. Terminal portion is lined by simple squamous non-keratinized epithelium. So dito nakikita natin, natandaan nyo lang dito yung Leiter's gland. So these are small mucus secreting gland. No? And then you have the lacunae or Morgagni, tunica propria, known as the lacuna Morgagni located at the mucosa. So muscular niya, inner, longitudinal, and outer circular. Adventitia, andyan ulit yung mga blood vessels natin, areolar connective tissue, and nerve plexuses. Female urethra naman, short, lined by first part niya, transitional, middle part, pseudostratified epithelium, and then terminal part are the stratified squamous non-keratinized epithelium. Made up of loose connective tissue ang kanyang lamina propria with elastic fibers and lymphocytes. Dito rin may Leiter's gland. So ito na, i-compare natin yung babae, no? So this is the rectum. Okay? Fallopian tube. So we have the ovary and we have here the uterus. Asan pa dyan yung bladder, no? So this is the bladder. Okay? This is the urinary bladder. We have the pubic symphysis. Okay? So posteriorly nakikita yung urinary bladder. So we have the external, okay, urethral orifice in daanan ng ihi. As compared mo yung location niya, no, doon sa anal area, napakalapit lang as compared mo sa lalaki. Kaya ang babae, mas prone sila magkaroon ng urinary tract infection. So muscular, inner longitudinal, outer circular, and skeletal muscle. No, may have urethral sphincter. Adventitia, ang laman pa din yan. Ulit, areolar tissue, blood vessels, and nerves, no? Yung male and female reproductive, mas explain natin mabuti yan. Ano nakikita dyan? Pag next meeting, okay? So we discuss the excretory system from kidneys, the histology of the kidneys, the tube, ureter, the bladder, no, anong itsura niya when filled with urine and with empty bladder, no? And then we all know that your excretory system most, no, is lined by your urothelium, no? Lalo na yung mga tube, okay? And then we already discussed the urethra, no? So external, no, anatomy of the male and female reproductive system was also discussed. And remember, no, in different layers, no, from mucosa, the innermost, submucosa. So you have your muscularis and adventitia. So pare-pareho naman, ganun yung kanilang layers, no. So take note din, no, kung sabi natin kanina, di ba, na ang distance ng male urethra sa anus is malayo. Ang distance ng female urethra sa anus is malapit. So, ano yung most common organism na nagkakos ng urinary tract infection? Yes, Andrew.
Bacteria po.
Yeah, bacteria. What? Very good. Wala ka.